Hi, everybody. There we are. I'm going to talk to you about her soon. She's blind in one eye. Her name is Indy. She's a rescue dog. Those of you who've been following me know about my golden retriever. 6 months have passed. I can't even believe it. But anyway, we'll talk about her another time. She's very, very special. And adopting these dogs from rescue places is just really amazing. All right, today, listen to what we're going to talk about. We're going to talk about maggot therapy, or another word is maggot debridement therapy or larval therapy. All of this is still used, as it was many years ago, for wound debridement, for wounds that are resistant to antibiotics or wounds that need a little help. Okay, so I want to count down to the top 5 things about maggot therapy that is used in modern medicine today. Let's begin the countdown. Number 5. What is the history of maggot therapy? It does go back hundreds and hundreds of years. It was used by indigenous tribes, by military surgeons, where they noticed that this type of wound therapy allowed these wounds to heal faster and heal completely. It was formally introduced by Dr. William Baer from Johns Hopkins back in 1929. He's an orthopedic surgeon, and Dr. Baer introduced this where he then was able to publish papers, teach others, and prove that this type of debridement therapy was very successful. Today, maggot therapy is used and recognized as a modern medical treatment for wound care. Number 4, why are they even used today? Don't we have other things? What about wound vacs? Okay, I'll come back to that, but that's a completely different thing. They consume dead tissue. That is what debridement is. They release the enzyme that breaks down damaged tissue and inhibits bacterial growth, certain bacterias in the wound. And this process can help heal wounds when other treatments have failed. Maggots are often used for chronic wounds, especially in patients with conditions like diabetes and poor circulation. Number 3, where are these maggots found? Well, they aren't found in the environment. They are lab grown. A lot of people don't know that, but they are grown in a sterile environment. They are very, very tiny. And we'll talk about that the therapy is sterile and medically supervised, and they are disinfected and supplied in controlled medical packaging, so they are safe for clinical use. Maggot therapy is not the same as a wound vac. A wound vac is used for vacuum-assisted closure device. It's used for gentle suction to help the wounds heal, where maggots are sometimes used instead as the first line to remove the dead tissue so that the wound can begin healing. Here's my question to you. Could you do this? Do you think that if this was the only option you had for your wound to heal, well, there's always other options, but say that this option was presented to you as being a very favorable option for a good outcome for your wound to heal. Would you do it? Would you consider it? Would you have to take some type of anti-anxiety medication to get through it? Let's talk about how long this might take. All of these tiny, sterilized, clean little maggots are going to go on the wound. And then something goes over them. There's another delivery system too, where they are enclosed in something and put on top of the wound. Again, something is covering them. And it can take anywhere between 2 to 4 days that these little bugs are going to be debriding and doing their job. So for many people, the psychological impact of what's happening is the hardest part to get through. I don't blame them one bit. I never worked with patients who had to have this. I know it was going on, though. It was talked about a lot. I worked mostly maternal, child, and peds. We definitely used a lot of wound vacs in pediatrics, but we did not use this type of maggot therapy. Do you know anybody who's had this done? And again, could you do this? I guess I could do it if I had to. I mean, like everything, right? If we had to do it and it was the best thing, get through it. If it takes 2 days or 3 days, get through it. They don't multiply, in case you're wondering. They can't multiply while they are doing their job at debridement. After 2 to 4 days, the reason it's all done and over with is because they don't produce that enzyme anymore. I think good preparation for the patient, helping them get through this psychologically, and having them see maybe once things begin what the improvement looks like will definitely help them continue on. Would it have to be repeated? Yes. For some people, it does. Okay, number one, what may replace maggot therapy in the future? Well, the whole goal then would be to create something that these insects produce, the beneficial things that these insects produce, which is, of course, debridement, but also the antibacterial compounds in an enzyme form that these maggots produce. So once that maybe is achieved, then for sure, there could be a replacement for the actual insects. Maybe some advancement in different type of wound dressings might be coming around the corner as well that would speed things up and mimic this type of therapy. Okay, maggot therapy may sound very unusual, but it highlights something very fascinating about medicine. My name is Lisa. I'm a registered nurse. I like to talk about really interesting topics in medicine, some myths and facts about medicine, some medical stories. And if that kind of thing is interesting to you, please consider subscribing. And let's say, have a good evening, Indy. Hi, Indy. Oh, you're such a good girl. Yes, I'm going to introduce you to my friends. I'll see you at the next video.